In each of my classes, I ask my students to introduce themselves and to tell me a little bit about their practice and their experience in healthcare. I want to do the same for you and to tell you a little bit about my practice and what I have done in healthcare and how that influenced me to make the career decisions I made. I hope by understanding my career path that we will find similarities in our perspectives and it'll facilitate better discussion. I began my nursing career by studying at the University of Tennessee. Tennessee was home to me, and like any nurse, the university from which you graduate becomes part of what you are and who you are and how you practice. So I will always be a Tennessee volunteer and I will always be a University of Tennessee nurse. It was the education that I received there that helped me to make my early decisions. One of those early decisions was to step outside of my comfort zone and to leave home. One of my professors handed me an application for the Junior Co-Step program with the United States Public Health Service. I filled out the application, and within a month or two, I received a call offering me a job. I accepted immediately, and their first question was, "Don't you want to know where it is?" And my response was, "That would be nice." That was the beginning of a great relationship with the U.S. Public Health Service. After the beginning of my career there in that first summer, they offered me a senior co-step position, which paid my tuition and my salary for the remainder of my master's degree. And so I spent 3 years at St. Elizabeth's Hospital in Washington, D.C. Sadly, St. Elizabeth's Hospital at that time was in the beginning of its decline. And the decline had started by a simple policy: the decision to turn the hospital over from being run by the federal government to being run by the District of Columbia. Funds were to follow, but like many federal policies, the promised funds didn't follow, and over time, the disintegration of the infrastructure began. And while still beautiful, many people will recognize the top left picture from the grounds where they marched in the movie An Officer and a Gentleman. But at that time, we went through periods of time where we didn't have enough food to adequately feed the patients. We were all working huge amounts of mandatory overtime, which all nurses know. I doubt anyone who has RN after their name has not had mandatory overtime. But at St. Elizabeth's, it could be to the extreme. One day, after I first began, I went to the chief nurse and I asked her when I was going to get a day off. And she explained to me as an officer that I was on duty 24 hours a day, 7 days a week. And then finally, she stopped and she said, "When was the last time you had a day off?" And I said, I hadn't. I had been there 30 days at that point, and some of those days were double shift. Policy from day one impacted my career. But sometimes for hard work you get rewards. So one of the assignments they sent me on was to be the medical officer on a NOAA research vessel. It went to Dutch Harbor, Alaska, to Kwajalein, and to New Caledonia. And while the time on its ship was hard work and many times boring, it was also equally exciting to see Dutch Harbor, where my father had been stationed during World War II on a submarine. Experience the crossing the line ceremony once was sufficient. I'm very grateful you only do that once. And to visit New Caledonia, which was beautiful. Along the way, I went to work for the Federal Bureau of Prisons. It was the first place that I decided that I really wanted to be the person that changed policy. It was there that I saw policies that surprised me. And I realized that there was a better way to do things and that it was the policy that was preventing us. And frequently, the policies that were preventing us didn't come from the local level, but they came from the federal government. I went from the Bureau of Prisons to the Division of Immigration Health Services, first running a clinic in Batavia, New York, and then in D.C. as the Chief of Field Operations. And it was while I was there that I took a temporary duty assignment to do mass migrations with immigration, and we went to Guatemala, which is where you will see these pictures. Approximately 500 people got on this small ship to sail across the ocean from China. And by small, what you see is all there was to that ship. 500 people were on it. The conditions were horrible, but it was the policies of a government that made people flee and hope for something better. While I have no control over the policies of a foreign government, I respect those people who work for state and other programs that actually do impact foreign policy. But what we could do is we could address the policies that have happened within our own organization. And sometimes it's the things we see that even further influence the decisions we make in our career. I was amazed that we sent people back to China. I was amazed that if we did a history and physical exam and we missed signs of torture and abuse, once the paperwork was done, there was no changing that or taking it back. Later, I was assigned to be the director of the Secretary's Command Center for HHS after 9/11. We took an old conference room with burnt orange chairs and we turned it into a state-of-the-art command center. The command center was supposed to be a hub of information that would allow us to make good policy decisions, and those policy decisions would guide our future responses to disaster. And we did make an impact. Over time, the office grew. The command center became something that most of the government took pride in. People came to see it, and they realized that what we had created was a rapid way to share real-time information that was needed so that the people that did make the decisions, that did make the policies, were going to be able to make those with excellent information. One of the things that I took out of every policy decision was that we can't make policy without recognizing what people actually have in practice. It is one thing to sit in DC in a powerful position and to make policy without realizing that every clinic isn't the same, every hospital isn't the same, and every provider doesn't have access to the same equipment. Sometimes you make do with what you have. Policy must be flexible enough that it can be implemented broadly. It must also be feasible. Which takes me back to my education and your education. Everything that I learned about how to make policy and about who I wanted to be as a nurse and as a policymaker, I learned in college. I learned in my graduate program. And what I learned from my professors made me the instructor that I am and the person that I am. My objectives flow from what I learned from them. My goal is to instill a desire for service, to inspire joy in learning and facilitate lifelong learning skills, to develop students that are critical thinkers and exercise sound judgment, to ensure students master the basics and proceed into the vocation with confidence, to advance knowledge through service, research, and administration. I let research and evidence guide policy. I truly believe that if we want to set the policy agenda as nurses, as healthcare professionals, we have the power and the capabilities to do that. We just need to follow a systematic approach, making sure that we progress from defining what the problem is to including values, belief, and compassion in all of our decisions, to let the evidence, the research, and our experience guide us, to ensure that we make the public aware of what we are doing and that we remain politically engaged, that we minimize all the negative factors, that we organize and engage interest groups. Activation is critical. Social advocacy is critical. That we then move to public policy deliberation of the alternative. And there's always more than one alternative. And we need to learn to weigh the pros and the cons of all of our alternatives and choose the best. And we must always include compassion. Compassion must be evidenced and it must maintain human dignity for all. And finally, I would like to say that every career is going to have major milestones and things that we have accomplished. No one person can make huge policy changes in healthcare alone. We have to engage everyone. And to do that, we need to be active and we need to realize that we can do this better if we do it through larger organizations. We can do it through political activism, and we can do it through evidence-based practice and research that we bring to the table for those people that make policy. But in the end, what we actually have to do is tell a good story. Because for the people that make the policy, especially those that pass legislation, all of our facts, they don't convince the constituents. What convinces them is our ability to tell a good story. By the time the class is over, I hope you're able to tell your policy story in a way that will impact your practice into the future.